Okay, let's go through this. All right, I'm just going to start reading. Chris, Michelle, you go on. I'll catch up in a minute. Mary hit her face as she struggled to catch her breath. She had been so excited to go hiking with her children. Chris and Michelle were both home on fall break, and Mary had been looking forward to the family time. But she felt like she was hyperventilating, and now her chest was starting to hurt. Mom, are you okay? You look awful. Mom says, don't panic, but I think I need to go to the hospital. So they go to the hospital. They helped the mother into the waiting room. They went to the ER. They took her medical history, ordered an EKG. What's an EKG? Electrocardiogram, electrical activity of the heart, because her chest was hurting, right? Chest x-ray, blood tests, and also urinalysis. And then the doctor says, don't worry, you'll be fine once we get you off Topomax. Okay. And what's she taking Topomax for? It's a migraine medication. Okay. It was originally designed for epilepsy treatment, but it's also used to prevent migraines. And apparently, it's been working for her. So I guess if we just wanted to recap some of the symptoms she was experiencing: struggling to catch her breath, hyperventilating, chest starting to hurt. Let's look at her test results. Hemoglobin looks good. Hematocrit, which is your red blood cell count, looks good. Then they're measuring, let's see, this enzyme called creatine kinase cardiac isoenzyme. And the values are within normal range, so that's good. But why would they be? This is a cardiac enzyme, right? It's an enzyme that's found in the heart. Why would they be looking for that in the blood? Well, and more specifically, a heart attack. If you have a heart attack and your heart cells are damaged, then they release material into the blood. And so cardiac enzymes should not be in the blood, but if they are, it indicates that there may be tissue damage to the heart. It's the same reason why they look for liver enzymes in the blood. You're not supposed to have liver enzymes in the blood, but if your liver is damaged, then it can release those products into the blood. So there, she had all this chest pain and whatnot, so they want to make sure it wasn't a heart attack. What is abnormal? Just going down the list. Her pH. Her pH is acidic. What else? They measure two different values for CO2. And what are her CO2 values like in both of these situations? High, normal, or low? They're low. Is that surprising that her CO2 levels are low? Why are her CO2 levels low? She's hyperventilating. Her oxygen is actually really high. And that's also because she's hyperventilating, right? What about her bicarbonate? Bicarbonate is low. So we have two kind of things that are going on here. We have low CO2, and we have low bicarbonate. And what I'm learning with these acid-base imbalances is that you kind of have to determine which one of those is the cause and which one of those is the compensation. Okay. And if she's hyperventilating, that's resulting in low CO2. Would you think that that would be the cause or the compensation? I would guess the compensation. Okay. So she's hyperventilating to compensate. And so the cause, our guess would be right now, are these low bicarbonate ions in the blood. If you have low bicarbonate ions in the blood, what's that going to do to pH? Is it going to make it basic or acidic? If you have low bicarbonate ions in the blood, is that going to make it basic or acidic? It's going to make it acidic because there's not enough to bind up the free hydrogen. And what is her pH? It's slightly acidic. Yeah. I don't know. They just to be thorough, I guess, and maybe it can vary one way or another. The only difference here is this one, CO2, this is in millimeters of mercury, and this is millimolar. So yeah, I don't know if they measure those different ways, and it's just kind of two ways to confirm the same thing, maybe. Yeah. Okay, you guys can answer question 1 based on that. So the doctor comes back, sorry for the interruption. The good news is you did not have a heart attack, but I do think you're having an unusual reaction to Topomax. It appears to be inhibiting your renal carbonic anhydrase, leading to metabolic acidosis. We'll be giving you an IV, but they're going to taper her off the Topomax, and that should solve the problem. Okay. Bicarbonate is one of the main buffers in the blood. What's the definition of a buffer? Something that resists changes, delta is changes to pH. Let's see, blood pH is normally regulated by the respiratory system to control levels of CO2 and by the urinary system to control levels of bicarbonate and non-volatile acids in the blood. Let's orient ourselves here. Here we have an alveoli, so we're up there in the lungs. Here we have the blood. And then over here, actually this whole area represents the kidneys. And let's try to answer the following questions. What effect would, given the overall reaction, what effect would each of the following have on blood pH? What about hyperventilating? Hyperventilating, you're exhaling CO2. It shifts the equation toward the CO2, which makes it, what did you say? More basic. So it's going to increase pH. And I suppose we could draw this out on this whole diagram. Basically, you have more carbon dioxide being eliminated, and it's basically shifting this whole equation away from the hydrogen ions. What about holding your breath for an extended period of time? If that's the case, you're going to have an increase of CO2 in the body. So what's that going to do to pH? It's going to lower it. What about, what did we say happens with chronic diarrhea? What's the problem with chronic diarrhea? Well, you're getting rid of excess bicarbonate. So there's more free hydrogen ions around. So what's that going to do to pH? It's going to lower it, make it more acidic. And what about excessive ingestion of baking soda? Because baking soda is sodium. Sodium bicarbonate. And so that's going to lead to more bicarbonate ions. And what do bicarbonate ions do? They bind up free hydrogen. And so that's going to increase pH. It's going to make it more basic. Okay, so now we want to know so the whole deal with Topomax is that it inhibits the enzyme carbonic anhydrase in the kidneys, in the proximal tubule of the kidneys. And let's orient ourselves here. First of all, we're looking at a kidney tubule. This, I guess, is in the proximal convoluted tubule of the kidneys. And again, here's that kind of equation, or what's going on here. This is the tubule lumen where the filtrate is passing through. And here's bicarbonate in the lumen. And again, to get from bicarbonate to get from the lumen into the blood, it's got to go through this process where it combines with free hydrogen and it gets converted to water and free CO2. And a big thing to notice here is that this process is facilitated by Ca. What is this Ca standing for? What's that? That's carbonic anhydrase. So carbonic anhydrase is converting this bicarbonate to H2O and CO2, which then enters the tubule, gets reconverted back to bicarbonate, and then that bicarbonate is able to go into the blood. What is Topomax doing to this carbonic anhydrase? It's inhibiting it. So I'm just going to put an X through it. Oops. So Topomax is inhibiting carbonic anhydrase. And if you're inhibiting carbonic anhydrase, how is that affecting bicarbonate that's actually going into the blood? That's the connection that we want to make. How is Topomax resulting in a decrease in bicarbonate in the blood and therefore acidic conditions? Well, if carbonic anhydrase isn't doing its job, then you're unable to take bicarbonate and move it into the kidney cells, right? And if you're unable to move it into the kidney cells, you're unable to move it into the blood. So basically, what is Topomax and the inhibition of carbonic anhydrase? What is that doing to levels of bicarbonate in the blood? Is it increasing them or decreasing them? It's decreasing them. And that's causing her acidic conditions. And what type of acidosis did we say this was? What category of acidosis this is? That it's metabolic acidosis. And if the kidneys aren't able to correct the problem, what's going to come in to try to save the day? The respiratory system. And what can the respiratory system do to take acidic conditions and try to make them more neutral. Hyperventilation. Because you decrease the amount of CO2 in the body. Which shifts the equation this way, and it takes this free hydrogen, binds it up with bicarbonate, and binds it up in water. Predict the effect of Topomax on the pH of her urine. That's a good question here. So carbonic anhydrase is being inhibited. Here we have bicarbonate that can potentially become part of the urine, or it can go into the blood. First of all, what is Topomax going to do to the levels of bicarbonate in the urine itself? Are they going to be high or are they going to be low? They're going to be higher because bicarbonate is unable to go back in the blood. So you're going to increase the amount of bicarbonate in the urine. And if you increase bicarbonate in the urine, what is that doing to the pH of the urine? Her blood is acidic because she's unable to get enough bicarbonate in there, but it's the opposite in the urine. We have too much bicarbonate in the urine. So what is that going to do to pH? Is it going to make it acidic or basic? It's going to make it basic. It's going to lead to an increase in pH. You guys can answer that one. Which of the following treatments would you recommend to correct Mary's problem? Breathing in a paper bag. Would that make her problem better or worse? It'd make it worse. How come? You're keeping CO2 in the body and you're making the blood more acidic. So we don't want that one. What effect would holding her breath have? Same thing. Keep more CO2 in the body, make it more acidic. Is this reasonable? An IV of pure bicarbonate in isotonic solution. So basically we're taking bicarbonate and putting it into the blood. That seems like a pretty reasonable thing. And lastly, why do you think that Mary developed these symptoms of acid-base balance while hiking? You know, what caused it to really kick in during hiking that wasn't a problem before? What happens to the production of CO2 during exercise? It goes up and makes the body acidic. And so maybe just, triggering that acidic condition kind of triggered the whole. I'm struggling to put together a direct link. Can somebody help me out? So you're exercising, you're accumulating CO2 in the body. That's a good way to put it. Think about it. The medication is already causing. Wait, is it? Her CO2 levels are low because she's hyperventilating. I don't know. I guess the fact that she's already creating an acidic situation for herself through exercise maybe kick-started this whole metabolic acidosis. I don't know if I'm able to give you a direct link between the two, but just kind of generically, maybe that's something you can say is that the exercise and the accumulation of CO2 and the acidity in the body kick-started the metabolic acidosis. you guys can think of something more direct, then that's good. Depends what's causing the acidity. Remember, if you have a lung impairment and you can't breathe out CO2, then you're going to have high levels of CO2 in the body, and that's going to cause the acidity. If you have a lung impairment and you can't get rid of CO2, then you're going to have an accumulation of CO2 in the body. That's respiratory acidosis, where high levels of CO2 in the body because of lung function are causing it to become acidic.